This is our weekly media briefing update. The Premier is unable to join us today, as we announced earlier on that he had tested positive for COVID-19. He is at home self-isolating. We wish him a speedy recovery. Hopefully he will be able to join us once he has completed his 14 days of isolation. So today's briefing will be done by the MEC for Health, Dr. Bandile Masuku, as well as the MEC for Education, Panyaza Lisufi. As you know, so Dr. Masuku will deal with all the issues pertaining to our health intervention, and MEC Lisufi will deal with matters related to education. Of course, we will be able to answer your questions about our overall response. So without any further waste of time, I would like to invite Dr. Masuku to start with the presentation, and then of course MEC Lisufi will follow him. Over to you, MEC Masuku.
Thank you. Good afternoon, everyone. And it's good to have you here with us today as we do our weekly media update. Today we'd like to start by indicating and also expressing our well wishes to the Premier of Gauteng and also the Premier of Northwest and the Premier of Western Cape, who have this week have tested positive for COVID. We hope that the 14 days that they will endure with all the symptoms, they will be able to flow through and survive and be able to recover and come back to lead us in the fight against the pandemic. It's an important aspect that we always start just to indicate the 6 pillars that the response of Gauteng have been based on. These pillars we have always reflected on them. There are 6 in number, and this is the work that we've been doing for the past 4 months. Today, we would want to cover the health response, and this is just the national picture. The first slide that we're going to deal with deals with the national picture that confirms the number of cases in the country, the number of recoveries, which are almost over 47%, and the number of deaths that we have actually had as a country, and the number of conducted tests. It's an important thing to talk about the test as of now, that as a country we have done tremendous work, and this is the work that we need to applaud our lab technicians, our lab services, both the NHLS and all the lab companies that have actually helped us in dealing and testing all our people. When we go to the next slide, you would see that we have, as Gauteng, have been confirmed to be the highest province with highest numbers of confirmed cases, of active cases. We have passed the 80,000 mark, and it gives us that as Gauteng we have got 34% of all the confirmed cases overall in the of confirmed cases, and we've got 47% of all the active cases as of now. The next slide will indicate. The next slide will indicate the figures as we see them. It's not moving. Can we move to the next slide? The delay is going to cost us. Sorry about that. We'll just have to make sure that we are able to get in sync with the slides. The next slide is the slide that we are following. It gives us an indication of a very interesting trend that we are following. The trend that covers the issue of positive cases, and the trend that shows the active cases, and the trend that shows the recoveries. In the past 2-3 weeks, we have been indicating to yourselves that we are worried about the curve, the green curve, as it was starting to plateau. But now we are quite encouraged that we are having a number of recoveries that are starting to come up, and the recovery curve is starting to go up towards the pink one. We are also taking solace on the curve, the orange curve that indicates the number of deaths, that indicates that we have not had any upsurge on the curve, and we are still within what is acceptable figure of the people that have passed on. We have always made a calculation of the number of people that have passed on in relation to the total confirmed cases. The numbers still reflect a 1% rate that we are actually looking at. On the 1st of July, it was 244. Today, we're on 515, and still it's within the numbers that we are reflecting on. The next slide will cater to indicate also that the recoveries, you will see from last week that the recoveries were lower than what we have today. The next slide indicates what is a skyline view, which the skyline view of the pandemic, starting from when the pandemic was on pre-lockdown, moving through different levels of the lockdown. You'll see that the numbers started to go up very sharply when we started to have, level 3. But of course, it's one of those things that we had expected, in case that we expected because of the number of increased actually movement in the province, and also with some of the activities starting to happen, particularly at the economic level. It started off with the mining sector, which we had the first upsurge that we had of 260, and after that, when we opened up, it went up. Let's move to the next slide. The next slide will cover the regional breakdown of all the cases that we have. Johannesburg is still one of the ones that is leading, and it also has got an increased number of recoveries and the increased number of active cases. What we take solace on is the number that is continuously increasing of recoveries. It's an important point that maybe when we are here to also indicate that the numbers of recoveries will all of course go up as we are going over a period of when we started level 3. And also what we take solace on is that the most of the active cases that we have in the healthcare system are still not within our facilities, are still having mild symptoms or pretty much asymptomatic, and hence the numbers in the hospital in the hospitals as we are going to present to you. Johannesburg still remains our big problem, but we are actually getting there in terms of consolidating and making sure that people are actually recovering. The next slide deals with the sub-districts. As of actually today, as of yesterday, it indicates that the highest number of an affected sub-district is sub-district F in Johannesburg, which has got the highest number of confirmed cases and also the number of active cases. This is also an indication of the previous slide, which we can move on to the next. This is also another slide that just confirmed both active cases, confirmed and active cases. And it's an important thing that we just have to demonstrate from the highest to the lowest. And this is what we'll normally say is the top 20 of all the sub-districts that are there. Okay. So we'll move to the next slide. The next slide also is a reflection of the highest numbers of active cases from the highest to the lowest. And Ekurhuleni has got, and Sidibeng have got, and Tshwane have got some few sub-districts that have got fewer cases. But Johannesburg and Ekurhuleni and Tshwane, they actually have the bulk of the active cases. And these are areas that surround mainly the townships and the areas that surround the inner city, the CBD, both in Tshwane, in Ekurhuleni, and actually Johannesburg. The next slide just indicates how the trend has been in the last 8 days, increase per sub-district. And I think the point we have made, we can pass the slide, on how Johannesburg has increased over the past 8 days. This is a slide that just indicates that we are closer to meeting out, closer to 1 million tests that would have been done. On this slide, we would want to also confirm that the backlog that we have had has been cleared, and most of the results have come through, and also it has contributed to the increase that we have had on the numbers that have been confirmed. It's quite encouraging, and also, like I've said, that we need to applaud our laboratory workers who have done quite well. This is a slide that we shared with you last week in terms of the scenarios and the models that are there. It's also just to indicate to the public, the general public, that there's a lot of work that gets done in terms of modeling, which is informed by the public health experts and actuarians, and also people who are dealing with data every day. We are looking at the situation where, when we look at it, the peak, the highest number of infected people would happen around mid-August or towards early September. And this can also depend on how much we can have influence on in terms of restrictions of regulations. We can pass the slide. It's also important that it indicates the number of beds that are actually required, which gives us a sense of the work that is done. The following slides that I'm going to present are going to just indicate to you the work that has been done on our facilities. Like you've said, last week we did indicate to you that our first part of preparation, our infrastructure, was basically dealing with the infrastructure refurbishing within our facilities and preparing beds within our facilities. And this is the work that has been done. Some of these facilities are actually underway, and they are actually working. We were with the minister this morning in Tshwane District Hospital, just to demonstrate and show the minister the work that has been done and the wards that have been prepared that are already admitting patients. There's a lot of innovation that we also appreciated in Tshwane District. The rest of the projects are still underway, which will be completed by the end of July. Let's pass. This is also another slide. In George Mukari, we'll have to indicate that the wards that were refurbished are already underway. They are in use as of on Wednesday. And these are the numbers that we are having. We are having almost 104 beds that are already in functioning, and they are working. We connected the oxygen actually to them during the week. We can pass. This is the work that we have reported on field hospital. Work is already happening in Nasrec to put up beds that are hospital beds that will have capacity for oxygen, IV treatments, and also be manned and actually be run by health professionals. But our plan with field hospitals is to make sure that all the patients that are stable from our hospitals will be stepped down to these actual facilities. They will help us to decongest actually our main hospitals where critical patients will be seen. This is the proposal of the status of where we are, and work is already underway. Like I've said, 120 beds are already almost complete by today, and the other 300 will be done by the 17th. But by the time we get to the 31st of July, would already be having almost 700 beds, which will be in actual function. The Sinaba, the planning has been completed, and the SNDF will be starting to move in, and work will start by end of next week. We'll be having something actually active in that space. The Tshwane Expo, all proposals have been done, and now we are just, I think the issue of appointing the contractor has been completed in this regard. We can pass. These are the number of the beds that are available that we have demonstrated, and when we talk about on this slide, we also want to mention that we have already formed a bed management bureau between ourselves as a public sector and the private sector, where we are managing all our beds that are actually available in the province, and also directing the traffic and directing patients and directing EMS where patients would be taken to when actually necessary. It's an important step for us to do, because if we don't run a proper management, it means we will also be having a haphazard way of managing the beds. But this has been in place for a week. Dashboards are active both for private and public, and we are actually doing more on that space. Let's pass. Let's pass. This is the number of the tally of the total tally of the bed capacity as of now, which also include the ones that are planned, which they will always be available as the time comes. Let's pass. This is also the work that is done with the ABT, Alternative Building Technology. These beds will be ready when we start our peak in the next month or two. Let's pass. Here we can also indicate on ABT that foundations have been put in place, and now we are going to be seeing walls coming up and wall pellets being built up. So in the next 4 weeks, we would be seeing something, and we'll be starting to use some of the structures there. This is the number of the patients that are in our hospitals as we speak. And as I've indicated, let's go back. As I've indicated, 81,000 out of 81,000 people who are actually confirmed cases, and over 60 or so thousand people who are active cases. Only 3,000 are actually admitted between us and the public sector. And this is the number of the people that are on a ventilator, which is 197 out of 81,000 confirmed cases. It's also important to indicate that since March, when we started our response, our first case of the pandemic, we already have admitted 5,784 patients. This is still a figure that is reasonable, and we take solace in that regard, and the patients that have been discharged are still very high. And the numbers of total deaths is still relatively low as compared to other countries who have passed the 80,000 mark of the patients who are confirmed cases. Let's pass. The next slide just deals with the demographics in terms of age and gender of the patients that have succumbed to actually to COVID. And maybe at this point we also just have to, as a Gauteng provincial government, express our sincere condolences to the families and friends and colleagues of those who have succumbed to COVID-19, and also express the word of appreciation of the hard work done by our healthcare workers who are treating these patients going forward. Let's pass. This is just the analysis of the deaths in terms of the comorbidities. The issue here is that you will realize that those patients who have passed or who have succumbed to COVID-19, they also had a pre-existing condition, and the one that has actually been a very big culprit is hypertension, followed by both diabetes and hypertension, and then diabetes. We are seeing a few patients that are coming up with HIV who are now coming, and particularly the young patients who have actually succumbed to COVID-19. The next slide is also just the days of the number of patients that who have passed on, the number of the days they've spent in hospital. And this is a disturbing trend that most of the patients who have passed on, they've spent only, the majority of them, they spent 1 day, meaning that they came already in a very serious condition or critical actually condition, which makes it difficult for us to turn back, because the mainstay of us having a good outcomes is to have early interventions and be able to prevent patients from complicating in that regard. We can pass. The next slide will be dealing with the number of GPG public servants who have been tested positive. And this is the number that out of 172,000 public servants in Gauteng, 2,630 have tested positive up to now. And this has happened since March. This includes public healthcare workers and our educators. And of course, we have sadly lost some of our healthcare workers who have been in the forefront in treating patients with the virus, and they've actually succumbed to the pandemic. The buildings, as we pass this slide, the buildings have been disinfected as we go to make sure that we reduce the risk of infections of other public servants going forward. Let's pass. This is the slides. The two next slides are the slides that indicates the amount of PPE stock that is available. And safe to say that at the moment, this is a stock that we have at hand, and we are continuing to acquire and procure more as much as we can. And it's an important aspect. Today, we also seen some of the innovations that have been put in place in Steve Biko. And we also had to see the Ward 8, which has been named after Prof. Stolz, who is our mainstay, a person who gave us the confidence, and who also gave us the plans on how to deal with the pandemic. And sadly, he succumbed to his chronic problem that he had early in the pandemic. The next slides will be just dealing with education, which the MEC will be dealing with it. Thank you.
You through the education update, just to update you since the reopening of other grades, that is grades R, grade 6 and grade 7. We were just wanting to give you an update where we are. You will recall that it was the Council of Education Ministers through the Minister of Basic Education, Menji Mutseha, that allowed us to reopen those particular grades on the 6th of July. If you go to the next slide, you will see the numbers that we're talking about, that the size and shape of the institution. In terms of grade R, we're expecting 124,911. You will see the attendance there. It's very, very low. It's just less than 40%. If you go to grade 6, we're expecting 212,000 learners to come. We are hovering around 70% in terms of attendance. In grade 11, we're expecting 159,000. As well, we are hovering around 70%. We'll get to the next slide where it will give you all those figures. But with the current learners that are here in grade 7 and 12, in grade 7, there are almost 180,000. The attendance is brilliant there. Also within grade 12, we are almost at 100% attendance with almost 106,000 learners in our classes. In terms of progress, as of the 9th of July, out of the 2,026 schools, we had 2,131 schools opening, and we only had 105 schools that were closed. The 105 schools that were closed, it's mainly due to COVID-related cases, where we needed to temporarily close so that we can decontaminate due to reported COVID-19 positive cases. But in terms of infrastructure, there are only 7 schools that we still have infrastructural problems that need to be attended. In terms of schools with special needs, that's Alston schools. As of the 9th of July, that is day 4, 110 of the 129 schools were opened. We only had 19 schools that were closed. Also, these schools was mainly due to COVID-reported cases. And as of 9 July, 667 of the 717 schools were open in the independent school sector. These are the schools that are subsidized by government, but also have their independent standing. You can move to the next slide. The reasons for closures are indicated. The reason why we have some of our schools are closed, and we really believe we need assistance here to clear the backlog, is that majority of schools have a backlog of decontamination. We rely on the Department of Health and some of our officials to decontaminate some of our schools. Unfortunately, this process takes long and is an area that we want to move with speed to clear, because it delays the reopening of schools. The second aspect, unfortunately, is community disruptions, like we had today in the majority of colored communities, and as well in Ekurhuleni, Etwatwa, we had community members calling for the disruption of classes. In Tshwane as well, we had lots and lots of people who are claiming to be leaders of a student organization called COSAS that are causing disruptions. And on Monday, we are quite aware that the entire Alexander, there is a possible shutdown because some formations in Alexander have called for a shutdown. But we are continuing as a department, regardless of those service delivery protests as well. And in some areas, we've now finally concluded the delivery of PPEs in all our schools. We have several of our districts that were closed. Unfortunately, we lost one of our acting district director in Ekurhuleni. He passed on this morning. And we also lost a director responsible for scholar transport in head office. She also died this morning. This is the situation that we are facing almost on a daily basis. As reported, almost all Gauteng schools with returning grades did open on the 6th of July, even though some were affected by the positive cases that were reported. However, we must emphasize parents are voting with their children in terms of grade R. Attendance at grade R is embarrassing, if not low. We have presented this matter to the Provincial Command Center, whether is it economically viable to continue to open grade R, because the attendance there is less than 39%. Some schools also reported temporary closures necessitated by decontamination and also disruptions from community organization. I've already alluded to that part. We can move to the next slide. Because of the challenges of delays in decontaminating some of our schools, the Defence Force have come to our rescue. They've made their facilities and their personnel available to assist us to clean, together with the Department of Health We are finalizing the necessary paperwork so that they can be part of the backup team that will assist us to clean some of our schools. There are some learners that are demanding that everyone must be tested first for COVID-19 before we can reopen the classes. Unfortunately, this is a very difficult call that we can meet. In terms of nutrition, we had some delays in Mamelodi, but those delays were sorted out, including transport challenges in the West Rand. But those challenges have been sorted out after I've consulted parents. These are the statistics I was sharing with you. In terms of learner attendance, the grade R is the lowest, actually it's poor in terms of our standards. The average attendance stands at 36%. At grade 6, it stands at 62%, and grade 11, it's just over 71%. In terms of teacher attendance, it's exactly the same. We can see at grade R, teacher attendance is around 73%. If we move to progress infrastructure, we can indicate of the 351 schools that we have vandalized, all of them now have service providers fixing the problems that they had, and those 6 schools that were burnt down, we have delivered 3 mobile classrooms each in those schools, and we have put additional delivery of 48 mobile classrooms to address space challenges in some of our schools. We only have 7 schools that remain closed because of infrastructure. This is mainly because the level of vandalism was too high, and there's no way that we can fix those schools overnight. We're intending to, if needs be, demolish and rebuild some of those schools. But learners from these 7 schools have been spread across neighboring schools, so they're not staying at home. Together with their teachers, they've been spread to neighboring schools. We think this will only be a major challenge when we open further grades next time. So 305 schools have been disinfected since the resumption of school. These are schools that reported positive cases, and the repairs are ongoing to some of the institutions that faced issues of vandalism, burglaries, and other related matters. We can move to the next slide. The next slide indicates the support that we're giving to schools in terms of teaching and learning. You will see that we've finalized our annual teaching plans. We've also organized a PowerPoint presentation for our teachers. Some of our schools have been supplied with softwares like Zoom and Teams so that they can use them for distance learning, and that we've recruited lots and lots of novice teachers to replace those educators that wants to go on early pension, or those educators that have shown symptoms of comorbidities, so that we don't have learners without educators. So those novice teachers that have been identified, we are providing them with the relevant skills and support, and we are also releasing all our subject advisors to go to the schools as part of our resource to supplement the work that is done by educators. A reporting tool on syllabus and school-based assessment coverage have been sent to all our schools, because this is very important in case we don't have to write examination or something happens to disrupt examinations. We're going to utilize some of the components of the school-based assessment as a tool to determine whether a learner can progress to the next grade. This is only in case we have that kind of a situation. We've also strengthened our distance learning, or what we call home education. We've established a 14-day learning activity. This simply means those parents that have chosen not to bring their children and they want their children to learn from home, but they don't have access to computers and other things, they can take advantage of this 14-day learning activity. What it means that every 14 days, the parent must come and collect information and assignment at the school, and after 14 days must bring them back, and the teachers will mark them and give the parents the next assignment for the 14 days. So the 14-day learning activity, what we call labs, is going to be the order of the day for those parents that wants to keep their children at home. We are also providing additional support in terms of learning topics, topic summaries, step-by-step guidelines for tutoring, assessment tasks, memoranda, and zero-rated electronic media educational programs to those parents that still feel that their children must remain at home. You can go to the next slide. If there are parents that have not yet registered for home education, this is the link that we've established, and we've committed ourselves that within 7 days will be in a position to respond to the parent if your child has been admitted to learn from home. So we'll encourage parents to use that link. It's www.education.gov.za/information/parents and guardians.aspx. It's a very important information that parents can save in case they feel that children should remain at home. We can move to the next slide. In terms of homeschooling, we've made it very clear that parents who apply for lockdown learning are fully responsible for the education and safety of their children, and learners will receive support from schools and they are still registered with them. But there will be no learners, and I want to emphasize that point, there will be no learners that will be deregistered from admissions register of the school. So we are urging parents to choose some of the options that they have rather than say my child will repeat grades next year. Even if your child is not coming back, please notify the school so that the school must not order sanitizers, face cloth for a child that is at home, and that will be a waste of money. That is why we want parents, even if you want your child to be at home, please make an application or notify the school and indicate if your child is not going to come back at all, so that we can make a reservation for admission for next year. But a child that has not come back and has not written some of our assessment, unfortunately that child will repeat a grade next year. Learners must be exempted from the HOD to qualify for lockdown learning, and examination will be written at school in the case of lockdown learning. So even if you are at home, but in terms of examination, unfortunately examination will only be written at the school for purpose of control, quality, and ensuring fairness for all learners. And parents who wish to apply for lockdown learning can access the following website addresses. I've gone through those website addresses, I don't want to repeat them. We can go to the next slide. The next slide gives us an indication of how many learners have made an applications in terms of learning from home because of existing comorbidities. You will see in terms of schools with below 5% learner applications, we've received 106 applications from learners who have comorbidities, but schools with between 6 and 10%, we only received 9 applications, and schools with greater 10%, we've received 5. But you can see majority of schools are below the 5% benchmark of schools, which give us almost 406 learners that have requested that they want to study from home purely because they've got existing comorbidities. If we move to educators in the next slide, homeschooling, in terms of the numbers that we have, you can see in terms of grade R and grade 12, we don't have huge numbers, but if you move to grade 6, you can see it's 156 learners that have applied to study from home. In grade 7 it's 157, in grade 11 it's 43, in grade 12 it's 55. Those that have comorbidities in terms of grade 6 is 84, in terms of grade 7 it's 68, in terms of grade 11 it's 25, in terms of grade 12 it's 19. And in terms of schools, we've got 61 schools that got a remote learning capacity and capability. In terms of grade 7, we've got 57 schools that have that capability. In terms of grade 11, it's only 16 schools that have that capability. And in terms of grade 12, we only have 19 schools that can offer remote learning without any major challenges. If we move to the next slide, these are positive cases that have been reported as of the 9th of July 2020. We've got 965 schools that have reported COVID cases, and we've got 294 learners that tested positive, and we've got 753 educators that tested positive, whereas 76 admin staff or office-based staff tested positive, and 33 general assistant staff tested positive, and we only have 3 youth brigade members that tested positive. So in total, we've got 1,159 positive cases within the schooling environment in Gauteng, and only have 105 schools that are closed as we speak, purely because they have to go through the process of contamination. Decontamination. Thank you so much. We can move to the next slide. If we move to the next slide, this is the number of educators that have applied because of old age. 3,699. These are over the 60-year benchmark in our schools. And these educators requested that they be released early because they fear working due to the risk associated with their age. Of the 3,699 that are over the age of 60, 2,117 are teaching at primary schools, whereas 1,193 are teaching at secondary schools, and 389 are teaching at special schools. And in terms of possible comorbidities, age 60 and above is 3,699, as I've indicated. Those with short-term temporary incapacity is 2,119. Those with long-term temporary incapacity and ill health, they are 929. And you can see that we'll urgently need 6,747 young new teachers to come on board to rescue the situation within schools in Gauteng. So we are going out to look for 6,747 young teachers to replace the teachers that have reached the age of 60 or above. We can move to the next slide. These are the emerging risks that we've indicated. Indeed, the high number of new COVID cases that have been reported in our schools. There is an urgent need to manage the comorbidities, the disruptions that we've identified from communities, and the deployment of youth brigades to all eligible schools has been delayed, but we are dealing with that matter. And there are also some emerging infrastructure challenges, purely mainly because of vandalism and burglaries. We can move to the next. I will leave it here to MEC Masuku to finalize this particular aspect. Thank you so much, MEC Masuku.
All right, thank you, MEC. Yeah, we go back to MEC Masuku for the concluding remarks.
Thank you, MEC Lusufi, and let me conclude the press briefing.
You may proceed, MEC Masuku.
The technical glitches are many, yeah. Okay, thank you, DDG Tabo, and thank you, MEC Lusufi. I'm hoping that I've unmuted. Am I fine? Yeah, we are going to get used to this technology of working remotely, and also making sure that we are able to decrease physical contact. So what we are saying as concluding our press briefing is that our response plan since March has been about saving lives. It has been saving lives, and it is a bit about making sure that we are able to make sure that people who enter our facilities, they leave them alive. And all the preparations that we have been putting to place has been about saving lives. All the work that our clinicians have been doing, all the innovation that we have been putting to place has been about saving lives. Our health response, whether we are improving infrastructure, procuring medical equipment, adding additional personnel on the floor, and making sure that we are able, this will put us in a better position for us to be able to weather the storm. The clinicians have emphasized that early intervention are important, that meaning that oxygenation, fluid supportive treatment, prone position, and some blood thinning agents comes in very handy in making sure that we prevent complications and also prevent mortality. We have enough hospital beds. Yes, we are seeing the pressure. Yes, we are feeling the pressure and the tension, but we are in a place that we are going to be able to cater for all the patients that require services. Together with private sector partners and our national government, we are increasing our bed capacity in all our facilities. We are putting triage tents in all our facilities to make sure that we decongest our accident and emergency departments, which by and large are the ones that have a bigger problem of having the congestion in our hospitals. We are also underway, like we said last time, that Nasrec will be ready with 1,000 beds. Tshwane Expo will also be ready with 1,000 beds by the end of this month. When we start the month of August and going towards the peak, we will be ready to have all the necessary capacity to make sure that we are able to accommodate and treat all our patients decently in our facilities. We have added 440 health professionals. We are continuing to add more, 400 nurses. We are also continuing to add 400 doctors to be appointed into the system. We are also working hard with our private sector, where we have ordered a lot of medical equipment which will help us to treat our patients going forward. Indeed, we have to make a call that as we weather the storm, some of the regulations that we have called for should be strictly be adhered to. People should continue to adhere to a point of staying home, making sure that they avoid going out when they are not supposed to, avoid going out to places where they are crowded, avoid organizing social gatherings. We've heard of incidences of people who have organized weddings, who have organized baby showers, and we just feel that that is partly irresponsible. We still have a role to play as a society and as a community to make sure that we disrupt and we reduce the rate of the infection. Let's move to the next slide. It's an important call that we are making, that we still have a role to play. We still have a bigger impact that we can make as a community and as a public. The best thing that we can ever do in this regard is just to embrace the new normal by changing our behavior. When you go out to the public, please wear your mask, keep a safe distance, a social distancing, and let's contribute to make sure that we reduce the spread of the virus. It is everyone's responsibility to play a role in taking the necessary precautions to measures to stop the spread of COVID-19. One of the best mechanisms to protect ourselves is to treat everyone that we meet as though they have tested positive for COVID and maintain a 2-meter distance, adhere to the lockdown regulations, and practice the golden rules of hand hygiene, good cough etiquette, and wearing a mask. Let's play our part and we can stop the spread. Thank you.
Thank you, MEC. We've come to the end. We will now take questions. I need to just check with those that have joined us on Teams if there are any questions. Okay, if I don't see any hand or any indication, you can just shout and then I'll allow you to ask. All right, that's fine. Then I'll just proceed to read the questions that we've received on WhatsApp. The first one is from Arisa from Netwerk 24. And the first question says, which regulations will be enforced in Gauteng to slow down the spread of the virus? Second question, is Gauteng health system prepared for the huge amount of cases that we are seeing now? Third, how many additional nurses and doctors is the department hoping to employ at the beginning of August? And the last question from Arisa is, according to predictions, how many cases and deaths will there be in the province by the end of July? Then we move over to the questions by Nozipo Mube from the SABC TV News. The provincialization of emergency services has disrupted operations in some parts of the province. Some have waited for 20 hours to close close to a day for assistance. How will this matter be addressed, and why did you decide on this move at such a critical time? Then we move over to a question from Rainet Naidu from ETV News. Where are the biggest COVID-19 hotspot areas in Gauteng? Is the Command Council looking at implementing harder intermittent lockdown levels in the province, especially in the big metros? Then we have more questions. One here from Zoleka from the SABC. And the question, is there a mass grave site being planned in Johannesburg? I thought today we were talking about saving lives, not burying people. What is the state of health care, available beds, etc. in the hospitals? The strain on healthcare workers, what support is being provided to them as they continue to battle the pandemic? Then the next question is from, next set of questions from Nozintombi Mia from the SABC TV News. Could you provide clarity around the issue of mass graves being dug in the province? How many people have now been admitted to Nasrec Isolation and Quarantine Center? Last week, hospitals were already feeling the strain. How has this week fared? Then we have the next question. I can't see the person who's asking here. The Gauteng Premier had said that the return to more learners to school would cause a burden on the schools, and that the province would make representation to the national government to raise this. How have the schools been managing so far? Then the next question there, has the Gauteng Command Council make representations on the issues of instituting harder lockdown measures? And then the next question is from, I still don't see, I think they're all from the SABC, these ones. How is the Premier doing at this point? Since Gauteng is the epicenter, what are some areas you are looking at to prepare for the peak? Then lastly, are schools coping since most of the learners have gone back to school? And I think I'll just go to one more question there from Claudia from Business Day. What is the average ratio of doctors to patients in the province at this stage? What are the oxygen levels, and do we have enough? And then lastly, how many beds do we have available in Gauteng? How operational is Nasrec, both in terms of staff and in terms of critical supplies such as oxygen? Have you started referring patients to private hospitals? If so, how many? Yeah, and then I think linked to that, there's a question about why is Nasrec and Tshwane not yet ready? I don't know why you say they are not ready. Okay, these are the questions. With regard to the questions of representations that the Gauteng Provincial government made to the national government, Those were indeed made over the weekend on Sunday, last week Sunday, and the national government will be able to communicate about how the issues will be dealt with. So we will not necessarily answer questions about those, as they are now being handled by the national government. And I thought the MEC made it very clear that today we are talking about how we are saving lives. The issue of barriers, of course, we have been asked about these questions every week as we do the media briefing updates, and we'll continue to deal with those questions. But we really want to emphasize that our response, our comprehensive health response, is about saving lives. But the MEC will be able to elaborate further on that. So we will answer the questions, but I see there's a hand here. Queenie, can you please ask your question?
My question is about the meeting with the Beer Association of South Africa. They've gone on to say that they've been trying to meet with the Gauteng Provincial government to speak about whether, to basically say that they don't want any of the operating hours to be cut because it could cause chaos in some way. So I just wanted to find out if this meeting has happened, if they've approached you yet.
Okay. We'll deal with that. But of course, as I said, this is a matter now that is being handled by the national government. Do I see any other hand? No. In that case, I will ask the MECs to answer. MEC Lesotho, are you ready to start? Is MEC Lesotho there?
Yes, I'm here. Can you hear me?
Yeah, please, you can answer the questions, MEC.
Thank you so much, Cabo. Thanks for, even though I've missed a couple of them, I had some connectivity challenge, but let me indicate that in terms of available space, we are now at 33% across all our schools. If we brought all other grades that the minister announced, would have been at 52%, because those grades were held back. We don't have any challenge of overcrowding. It's only our large schools. We've got almost 52 of these schools across the province. That is why we had to provide additional mobile classrooms, a total of 48 mobile classrooms to take care of that aspect. I think the main challenge on learners that want to study from home, the main challenge is the ability for parents to follow that. With the economy opening, we are seeing majority of learners being left out, and that's our main one. Obviously, the grade R attendance, Tabo, it's a cause for concern. At this present time, or at the rate that we are going, it sounds that it's not economically viable or financially viable to open those classrooms if the number of learners are as low as they are. But hopefully we will finalize the data capturing by today, and we'll have an average for a week, and it will then influence whether we continue to have grade R's. Obviously, there are parents that prefer the children to come back and they've got the right to have their children at school, but there are those parents that have voted in majority in terms of using their children to say they're not happy that the schools should reopen for grade R. So we're working around those issues. We've taken it to the Provincial Command Council for guidance, and the Provincial Command Council is going to guide us whether we should continue or not. But overall, I think the schooling environment is still safe thus far. And we urge parents that it's better for children to be within the classroom rather than be in the township or areas where they are not screened, they are not practicing social distancing, and they're not also wearing face masks. But within the schooling environment, They are guaranteed social distancing, they are guaranteed sanitization, they are also guaranteed face masks. So it's a controlled environment, and that's the environment that we really believe learners are better off, rather than being sent to buy food and things in the townships or in other areas without protection. And that's the part that we are very worried. We are monitoring the situation. The minister's given us 2 weeks to bring other grades. I think when those other grades come on, that's where we start to have some challenges. Thank you so much.
Okay, thank you, MEC Lusufi. MEC Masuku, your answers, please.
Thank you, MEC Lusufi, DDG Masebe. I have. I'm going to start by just talking about the provincialization of EMS. It is a 4-year-old program that was a resolution of 2016 by the Provincial Executive Council of Gauteng, where they took a decision that EMS will be provincialized. The process had begun, completed when we took over as a 6th administration. The process had completed in West Rand. The process was completed in Sidibeng, and we only, when we came in as the new administration, had to complete Tshwane and Johannesburg and then Ekurhuleni. So it is a decision that was long taken. It's not a new decision, as it's purported by some. It is a decision that was aimed at making sure that we increase the efficiency and the capacity of EMS. And at the current moment, EMS in Gauteng remains one of our shining armor, our beacon of hope in terms of organization, in terms of administration, and it has been doing well. We have recently concluded all the metros, Ekurhuleni being the last one that we have concluded. I know that the first weekend on when we concluded the process, Ekurhuleni had problems in terms of the lines and the technicalities, but that have been sorted out, and that we are continuously going to be increasing the capacity of our base in Ekurhuleni in all the areas and all the other areas that have been affected by provincialization. Tshwane, the process was completed long time. I'm not sure what was the whole thing all about with the recent correspondence that they've sent out. In our books and in our data, Tshwane had been doing less than and attending to less than 5% of the calls, and mainly they've been doing most of them the emergency that relates to fire, and they have not been taking care of the rest of Tshwane, which was the responsibility and still the responsibility of the Gauteng EMS. So the issue of provincialization is not a new decision, it's a long-standing decision, and we just had, as a new administration, complete the process so that in the next coming years, we will be creating proper capacity using the economy of scales to make sure that we're able to service our people in the province in terms of medical emergency. It's also important that when we have to indicate that Impilo app has got a function that helps you as a public, as a general citizen, to be able to call for the service and call for the ambulance, and it makes it easier for the ambulance to locate you in terms of tracking, and you are also able to locate and track how far the ambulance is from you, and you can be able to make sure that you are able to get the adequate and the specific type of help that you are actually requiring. So on provincialization, I think that will be sufficient, and I think it's something that we are glad that we have completed the process. It was not a very easy process, particularly after the local government elections in 2016, when other metros were taken over by some of the political parties. The negotiations were quite difficult, and the process was pretty much a difficult process to manage. The second question, we have to indicate clearly and explicitly that there are no mass graves that are being dug up in Gauteng. There is no grave that is being dug up currently. The second part of this is that there is no tender to dig up graves in Gauteng. The issue that was done was to check the capacity, because part of the response plan that we have to the pandemic includes the part that we have to assess and plan on the issues relating to the capacity of the mortuary, the capacity of our grave sites. So what has occurred, it is not about digging, it's not about tenders, there is no grave site that is being dug, but we can tell you about the capacity that the province has in this regard. Like we said, that it's not only today that we are about saving lives. Since we started our response plan from March, we have been very clear in our approach. We have been very clear in following all the necessary stages of the plan. One of the important stages of the plan was doing testing, tracking, and tracing. The other part of the stage was to make sure that we are ready medically to be able to treat patients. And this has been our work, and this has been our report. Every week as Gauteng, we have been transparent with all the work that we have been doing. Of course, there are some people who have indicated that they are not aware of our plans. Clearly, we cannot be blamed from the ignorance of some professors. It's their own ignorance. We cannot be blamed for that. I think what we can only say is that the plan has been shared, and it will continue to be shared with the public every week on what we are doing and the progress thus far. The issue of the matter that relates to bed availability, we have been reporting ever since. Our bed availability has been increasing, and yes, the system has had strain for the past 3 weeks, but with better management of our beds between ourselves and private sector, even within ourselves as the public sector, we have managed to ease out some of the pressure. The fever tents that have been put out are going to help us a great deal in making sure that our emergency and accident departments are not congested, particularly by the patients who are awaiting results, who are PUIs, who need to be taken care of in the meantime. The tent that we saw, the fever tent that we went to see in Steve Biko with the minister, has got also the capacity to do ICU and critical care. A patient can be connected to a vent whilst we are waiting for the results, whilst we are waiting for a bed to be created or a bed to be made available for the patient to be shifted to. So that's what we have been doing. And the strain on our healthcare workers, yes, indeed, they are feeling the strain, and that's the only motivation I think some of us have that makes us to wake up in the morning, that there are people who sacrifice, who dedicate their lives to go out and serve our people. So as leaders of the province, we are kept motivated by this motivation that we see and the energy we see from our healthcare workers. So it becomes important that the provision of PPE becomes our major priority in making sure that they don't run out of PPE. And even in the case they run out of PPE, we have a hotline number which is 24 hours available to make sure that we can be able to replenish any other type of PPE that is running short at that particular point. So it's an important aspect about our protection and the work that we are doing to make sure that we reduce the strain on our healthcare workers. The additional staff that we are hiring, it's also part of relieving the strain, because we understand that fatigue and burnout might crop in. The other aspect that we have launched with our faith-based organization leaders is also having a Thursday that we have put aside as an appreciation day, where we are going to have activation of psychosocial activities across the province, where we are going to be talking and engaging our healthcare workers in activities that uplift their spirits and counsel their problems and all the issues that they are facing. The bed availability, like I've said, maybe just to close off on the issue from SABC, is that currently we are sitting closer to 11,000 beds that are available. That is between us and the private sector. And these beds from our side, because we are continuously opening and commissioning wards that have been refurbished and beds that have been commissioned recently. Like I've said, we have actually opened up almost 64 beds in George Mukari this week, where we have connected oxygen, and next week we'll be opening another ICU facility at Charlotte Maxeke. So these beds will continuously be opened. And on top of the addition of the beds, the fever tents will give us close to 1,050 beds that will be only for the PUIs waiting to be triaged properly, and those fever tents will be having the capacity and the capability to give oxygen, to be able to put a person on a vent, and actually to even get IV treatment in that regard. In terms of NERVEC 24, I think I've covered, DDG Masebe had covered the issue about what we have presented to the National Command Council. But in essence, what we were trying to impress upon the National Command Council is to say that there are some regulations that, if better enforced, they will give us maximum impact in terms of reducing the rate of transmission. And those suggestions that we have made, yes, relate to alcohol regulation, yes, it relates to the movement, it also relates to the social gatherings in terms of crowd controlling regulations. So we are awaiting, of course, for the President, the Chief in Command of the South African Forces, to address the nation and tell us how he would have agreed or not agreed with what would have actually suggested as a province. There is no hotspot in Gauteng. Gauteng is a hotspot as a province, because we have been saying to yourselves as the public that the manner that Gauteng is compact and interconnected, it's going to be difficult for us to separate the province and divide it into different districts and approach it in different districts. So what we are saying is that we are approaching Gauteng, all of it, because all of the districts, all the sub-districts, we have demonstrated to you that there are very few sub-districts. Actually, there's no sub-district in Gauteng that doesn't have an active cases. So that's one thing that is important. So all of us must just, wherever we are, whether we are in Mrafong, in Wedela, whether we are in Bronkhorstspruit, in Tshwane, whether we are in Hammanskraal, all the areas in Gauteng are regarded as hotspot because of the number of active cases. So we treat Gauteng as a hotspot, and when we move from one level to another, we are going to be moving as a province, not only as particular sub-districts. The issue of the strain, I've covered it in terms of the beds, that our bed management team has been doing quite well, and it's managing the beds well, and we are able to secure beds where they are. We have not yet transferred patients from public patients to private. At the moment, we are still seeing the numbers that are private patients that are still private patients. So we have not yet referred any patient to private. Nasrec has been commissioned. Nasrec has got functional beds, 500 isolation and quarantine beds. We are putting extra 1,000 beds, which are going to be able to have a hospital bed capacity of giving oxygen, IV treatment, and also having adequate staff, clinicians who will be able to do that. Currently, yes, we do have doctors who work there. We've got clinical associates who work there. We've got nurses who work there, who take care of the patients who are in isolation, who take care of the patients who are in quarantine. And this is one of the good aspects that we are there. So Nasrec is functioning, and currently it has got over 150 people that are in there who are actually being treated and managed from that point of view. Yes, from the companies that provide oxygen, they've indicated that we have adequate oxygen in the province. We have adequate reserves in the province. But what also they have done, that they have also helped us with the fever tents where we have put them up, that they will help us to give reserve tanks for those tents to be able to give oxygen. We know that there's also a national project that is dealing and monitoring on the provision and the accessibility of oxygen. The issue of the Beer Association, we have not received any correspondence. We have only been seeing reports that we are seeing in the media. But I think as the Gauteng government, we are committed in discussion with anyone, because we know that we won't grow Gauteng alone as government. We need all the stakeholders. We need to deal with everyone, entrepreneurs and everyone, small businesses, to make sure that the economy in Gauteng is maintained and is running smoothly. And we are clear that we are going to engage them when the time arrives or when we receive the notification. And yes, indeed, we are going to add enough staff continuously. There will be some volunteers that we are recruiting now. There are people from the database that we are employing. The national office has given us extra budget to hire more, close to 600 new nurses. And the South African National Defence Force will also be providing extra hands. And remember that the South African Defence Force also will provide people who will help us for other general work that happens in our facilities. And all this is work that is continuing. We are not planning anymore. We are in the storm, and all our efforts and all our activities are aimed at weathering the storm. And of course, we will adjust and adapt as we go. We will seemingly take other things that are not working, but implement more those that are working. And our response plan, as we have said to you, that it is going to be dynamic and agile to make sure that we save lives. But it also has to be very comprehensive, as we have done. And we want to also appreciate the efforts and the assistance that we have received from the National Department of Health, the South African National Defence Force, in all what they've supported us in doing. And we hope that all this will help us to weather the storm, and it's going to be not easy, because part of it, it's not only government responsibility, it's not only about the security forces, it is also about us as a community, as a society, to take charge and make sure that we are able to live up and play our part in actually stopping the spread, in reducing the rate of the spread of this COVID-19. I think we are determined as Gauteng. We are not fazed by the numbers. I think we are strong enough and resilient enough that the storm will just pass and we'll all come through and enjoy the sun afterwards. Thank you.
All right, thank you very much, MEC. I think we have to end it here. We will meet again next week when we do the weekly update. Thank you very much.
Thanks, Tibos.
Hey, Panya, sharp.
You pulled it through, fellows.
Thank you. Thank you. Thank you. Thank you. Hey, Bandile.
Asikhulume phonini.
Not a discussion.
Bandile.
Yebo. Asikhulume, ngizokufonela no.
You remember that show? Asikhulume. Let's talk.
Hey, I used to like Yakola Negola. I was once an embassy president of South hosted in that show. It was not a very nice show.
Let's talk.
Why are you telling me points?
Yeah.
Please. Okay, for no one